Hi, I'm Hannah. I'll be your nurse today. Can you just tell me your name and your age?
Morgan, and I'm 20.
Nice to meet you, Morgan. So we're just going to do a head-to-toe assessment. I'm going to ask you a few questions, have you do a couple things. Just let me know if you have any questions. All right, so just ask, are you working at all right now?
Yeah, I work at Dartmouth, and I'm dietary.
And then, do you have any protection within this job?
Yeah, we wear masks and face shields.
And are you eating 3 meals a day?
I am.
Good. All right. So she's alert and she's responding to everything I'm saying. So she's alert and oriented. Her posture's good. Her hygiene's good. Her hair's clean. She's not in any distress. She's calm. She's relaxed. So everything looks good there. And then skin. Skin looks healthy, warm bilaterally. I'm not seeing any lesions or anything. No moles. No irritations, no masses again. Nails are smooth, even. There's no bumps or anything. And then hair looks clean to me and healthy. Are you having any pain today?
No.
So we're just going to start with your head. Right. I'm feeling, and there's no masses or anything. I'm not feeling any lesions. It's smooth all around. She's not wincing or anything. All right, I'm going to have you take your mask off. We're going to do a couple things. Can you close your eyes and tell me when you can feel this?
No. 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 No.
Good. And then, can you tighten your jaw for me? And then bite down. Good. So cranial nerve 5 is intact. Can you smile for me? Frown. Can you puff your cheeks? Good. So cranial nerve 7 is intact. Just checking the muscles of the face and sensation in the face. All right, everything looks good there. Move on to your eyes. So her eyes, they're white. They're not red or irritated. They're not drooping or anything. She can see me. She looks at me. And so no irritation at all. She's not closing her eyes or anything. So can you tell me when you see my finger?
No.
Good.
No.
Good. So cranial nerve 2 is intact. Just checking her sight. And then going to check your pupils. Good. Good. So pupils are equal, round, responsive to light and accommodation. So cranial nerve 3 is intact. And then can you follow my finger? Good. So cranial nerve 4 and 6 are intact. Just checking the muscles of the eyes, making sure she can see. All right, and her ears. So her ears look healthy. They're not pale. They're not red or blue or irritated or anything. There's no masses. She does have earrings, but they're not irritated at all. Clear ear canal. And just close your eyes and tell me when you can hear my fingers rubbing together.
No.
Good.
No.
So her hearing is equal on both sides. And cranial nerve 8 is intact, so she can hear me. And then your nose. So her nose is symmetrical. No irritation or anything, no masses, no obstructions of the nose. Nothing's coming, no discharge from the nose or anything. And can you close your eyes and tell me when you can smell this? And obstruct one nostril.
No.
Good.
No.
So cranial nerve 1 is intact, just making sure she can smell. And then we're going to look at your mouth and your throat. So her trachea is in line. Can you swallow for me? Good. And then her lips aren't chapped or anything. They're not blue. They're not dry, irritated at all. No lesions or anything. You open your mouth and say ah for me.
Ah.
Good. So cranial nerve 10 is intact. Her uvula is in line. Buccal mucosa is pink. I'm not seeing any sores or anything. She gagged, so cranial nerve 9 is intact. And then can you say light type dynamite for me?
Light, tight dynamite.
Good. So cranial nerve 12 is intact. So 9, 10, and 12 are intact. Alright, so now we're going to move on to your neck. So again, skin on the neck is healthy. I'm not seeing any masses, irritations. It's not red at all. No abnormal moles or anything. I didn't feel anything. And do you mind taking your shirt off? So can you raise your shoulders against my resistance? Good. And then turn your head against my resistance. Good. Turn in. Good. So cranial nerve 11 is intact. So spinal accessory present there. Okay, so we're just going to move on to your arms. So her arms look healthy. The skin again looks really healthy. I'm not feeling any swelling of the joints at all. No visible masses. Alright, I'm going to have you do a couple of things. Can you just raise your arms for me? Over your head. Good. Alright. Behind your back. Good. I want you to bend your arms. Good. And then flip your arms. Good. Out. In. Spread your fingers. Good. Alright, can you spread your fingers against my resistance? Good. And I want you to hold. Good. And then up. Good. Down. Good. And then up again. Good. Down. Good. So, muscle strength bilaterally is equal. There's no difference in her muscle tone. I'm not seeing, or I didn't feel anything. So, overall, arms look good. Range of motion is there. She can move them. She's not in pain or anything. So, everything looks good there. All right, we're going to move on to your thoracic. So, her thoracic cage, she's not barrel-chested or kymphotic or anything. And then again, the skin is healthy. I'm not seeing any lesions or anything. No visible masses or anything. Can you turn around for me? Alright, just palpate. And then I'm just going to percuss. Alright, so good percussions, resonant sounds. There's no consolidation there, no dullness of sound there. And then can you say 99 for me?
99. 99. 99. 99. 99. 99.
Good.
99. 99.
So good vibrations for tactile fremitus. And so no consolidation there present. And then can you breathe in and out for me? So good symmetrical expansion of the lungs. So no weakened lung or muscles there. Okay, so now we're going to listen. So just breathe in and out for me. Don't overexert yourself at all. Good. So clear lung sounds there. She's not struggling to breathe in or breathe out. No crackling, no wheezing. So lungs are clear and good there. All right, can you turn around for me? Good. And then I'm just going to palpate a little bit on the front. Good. And then we're going to listen again here. Good. 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 So clear lung sounds in the anterior side. So she's not struggling to breathe again. No forced inspiration or expiration there. So lungs look good. Everything looks good. So we're just going to move on to your carotid artery and take a look at that and make sure everything's good there. So strong regular rhythm on the carotid artery. And then we're just going to listen a little bit. So no bruise present there, so everything sounds good there. No abnormal pulsations. Alright, so I'm going to have you lay down and we're going to move on to the heart. So I'm not seeing any markings of the chest. There's no pulsations of visible pulsations of the heart. And then can you turn your head to the left for me? Good. And there's no jugular vein distension there. So everything looks good on her chest and the pericardium. Alright, so first, just going to palpate a little bit. Good. And then, so apical should be mid-clavicular line, 5th intercostal space. Good. And then right sternal border is the aortic. Just going to, let's do that first. And then left sternal border is the pulmonic, which is on this, it's in the 2nd intercostal space. Good. And then tricuspid, do you mind? Good. So tricuspid is left sternal border, 5th intercostal space. Good. And then apical, that which we'll listen for a minute. So the pulse for the apical was 70, and then good S1, good S2 for all areas. And then we're gonna just listen on the bell side. Good. So, and then can you turn to your left, and we're just gonna listen again to make sure there's no murmurs or anything. Cool. You mind lifting up? So no murmurs. Good S1, good S2. No abnormal sounds. Again, no pulsations of the chest. Everything sounds good in all areas of the heart. All right, so now we're gonna move on to your abdomen. So her umbilicus is in line. I don't see any masses or anything present here. So skin looks healthy again, so color is good. And everything looks in line there. All right, so first I'm just gonna listen. I'm not seeing aortic pulsations present. So good gurgling sounds. So all good bowel sounds in all four quadrants. Again, I didn't hear any abnormal sounds from the the artery coming within that area. And then I'm just going to cuss. So good resonant percussions. So no consolidation there. Everything sounds good. And I'm just going to lightly palpate. Looking for any masses, inflamed organs or anything. Good. And then deep palpation. Good. So your abdomen looks good. Belly button's aligned again. Skin again looks really good. No lesions, no masses or anything. And general temperature is warm. There's no pale color. No, it's not anything abnormal there. All right, we're going to move on to your legs and put your shirt on. Just checking range of motion there. All right, I guess you can lay down for now. We'll do some exercises. All right, so can you abduct your leg out for me? Good, back in, and then up, down, good. And then push up against my resistance, good. Down, good. Up against my resistance, down, and then out, in, and then you can go up. Good, down, good. So looking at the skin on the legs, so there's no irritation. I'm not feeling any swollen edema or anything. No swelling there, no irritation, no redness or anything. Just gonna take your socks off. Yep, so feet look healthy as well. A little cold, but same bilaterally. Skin looks good. Temperature equal. Alright, so now we're just gonna have you slide a bit and work on your knees. So can you lift your legs up for me? Good, down, good. Up against my resistance, good, down, good. It's good strength there. And then, so can you push your feet out for me? In, and then up, down. All right, push up for me. Good, down, good. Out, in, good. All right, so musculature that is there. So I'm not seeing any abnormal muscle tone on both sides. There's equal range of motion. There's equal strength present there. And all right, so everything looks good there. We're just gonna move on to neurological. So we're just gonna look at kind of your balance, your coordination, a little sensation. So we'll do some sensation first. So close your eyes and tell me when you feel either the sharp, the wooden end, or the soft Q-tip end. Close your eyes. Good.
Soft.
Good.
Hard. Soft. Hard. Hard. Soft. Hard. Soft. Soft. Hard. Hard. Soft. Soft. Hard. Soft. Hard. Soft. Hard. Soft. Hard. Hard. Soft. Hard. Hard.
Good. So good sensation there. No issues present there, so everything looks good. And then I'm just gonna have you do some coordination. So touch your nose and then touch your finger. Good. 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 All right. So good coordination. She's not struggling to follow directions or anything. All right. I'm just gonna have you walk. So walk towards me, and then walk back over. So her gait's even. It's smooth. I'm not seeing any hitch in step or anything. She's not dragging her feet. And then can you do heel to toe for me? Good. So good balance there. Not wobbling. Good. All right. And then can you stand by the bed for me? Good. Can you close your eyes? Good. So again, balance is there, coordination's there, sensation's there. Skin looks great. Every range of motion looks great. Everything looks good. Cranial nerves are healthy. Honestly, she looks good. Do you have any questions for me?
No.
All right. So thank you for your time. It's good. Thank you.
Mm-hmm.